Have you been stressed, anxious, or worried? Have you felt pangs of loneliness in recent times? Are you longing for greater connection with others in the world around you? In a phrase, are you looking for happiness? You are not alone. Millions of others are seeking this feeling of spiritual, mental, and physical wellness too. This podcast explores the underlying causes of unhappiness and shares with us the secrets of rewriting the frequent thoughts and redirecting the common behaviors that keep us in that state. Join forensic psychologist and best-selling author Dr. Neehall and her guests as they dive deep in the realm of psychological wellness and explore ways of finding happiness on demand.
It's my pleasure to introduce you to Dr. Jaggi Rao, who is a pioneer in his field. I don't know if you know this, but he's a double board certified dermatologist in Canada and also in the USA. He's a certified cosmetic surgeon, completing his fellowship with the Academy of Cosmetic Surgery in Southern California. He has a significant number of accolades in the realm of research, teaching, and cosmetic surgery. In 2011, he was the recipient of the Avenue magazine Top 40 Under 44 for his creation of Consult Derm. That is Canada's largest teledermatology platform. Did you know that? He sits on the board of the Canadian Association of Aesthetics Medicine, is a consultant to government on laser safety, the pharmaceutical industry, and professional sports teams. He's the founder and leader of Dermicon, Canada's largest dermatology conference for family physicians and pharmacists. He's also the creator of Aesthetics Medicine Training Academy. Dr. Rao has established a cohesive curriculum to teach many professionals the art of injectables and the science of lasers. He's a clinical professor of medicine at the University of Alberta. On a personal note, he's married to a fantastic woman, Dr. Namita Rao, who is a geriatric physician, and together they have 2 sons and a daughter. Allow me to introduce you to Dr. Rao. Jaggi, if I may call you Jaggi, I have a question. Here it is. A couple of years ago, you mentioned to me in passing that dermatologists seem to be a happy group. And it got me to thinking, I wonder why? What's the magic that you guys have?
Yeah. Oh, geez. Well, that is a bit of a loaded question, Joan. There's so many reasons, but I'd be happy to share it with you.
Yes.
First of all, thank you for that kind introduction. I wish my mother was here to hear that.
Oh, yes. It's a truth.
Way too kind. Thank you so much. Yeah. So I've been a dermatologist now. This is my 20th year of practicing dermatology. Before that, I was a resident for 5 years, and I was a fellow in California for an additional year. So I've been in this field for a long time, and I can say with certainty that it's one of the most happiest professions in medicine for sure, and maybe just generally. I'm very, very happy. I feel quite privileged to be in this field for several reasons. One is that unlike other fields of medicine, we deal with happier things. So, and I respect all fields of medicine, especially the ones that save lives. But in dermatology, we don't necessarily save lives, but we improve the quality of life. So we're talking about things that people want rather than they necessarily need, So we do a little bit of both. We do medical dermatology, but there's also this huge aesthetic, cosmetic, and psychological part of it that is huge, and I tell my residents that I teach, we could save somebody's heart from failing and people will be thrilled. But if you go ahead and you clear their skin from, say, acne or rashes such as eczemas and psoriasis, or even improve something that has been bothering them aesthetically, then we have some of the happiest people in the world. So by nature, what we're doing is a little bit happier. It's not necessarily life-saving, but it's quality improving, and that helps people. The other thing is if you are the right personality for dermatology and that you're a people person, there's a lot of communication that's involved. So unlike fields like radiology or or even pathology, where you're dealing with specimens and X-rays. We deal with humans, and the skin being the largest organ and the most visible organ is associated with a lot of psychology, and as a result, the ability to make them happier and improve their life is really a big thing. It shouldn't be taken lightly, and I certainly don't. A good example is if we can clear people's skin when they're young, we can sometimes not only make them happier during that period, but maybe even alter their career course or their life course, give them the confidence they need to go ahead and thrive and do things they never would have thought of otherwise, because of insecurities that are there. So this is the kind of medicine we're in. Also, our field of medicine in dermatology isn't restricted to just women or just children. Indeed, I see everybody with skin, which is from infants, newborns, right up to senior citizens. I see males and females. I see people who are rich and poor. I see people with literally all different skin types and creeds and colors and philosophies. And in order to really make them feel better and do better, it requires a certain skill. So all of that come together. Plus, we get to use our hands, which is great. In other fields, it's either you're in internal medicine dealing with thinking issues, or you're a surgeon where you're doing physical things. Dermatology is the full name of the specialty is dermatology and dermatologic surgery, because we do fine little things, fine motor things that are very, very nice. Sometimes we don't want to see, say 50, 60 people a day. We want to sit there and just focus on one issue with our hands. So that hand-eye coordination and manipulation is very good, and we can mix it. Finally, there's a business component to dermatology that we often don't see in other fields. In that regard, we're very much like a dentist. We can operate in a hospital with colleagues and you have that collaboration, or you can have your own private practice similar to a psychologist where there is a business aspect, because we have to keep the lights on and keep our employees paid and so forth. And so there's that business part of it that we often don't see in other fields. So we're talking about biology, psychology, surgery, business, you name it. We seem to encompass all of that. And that's what I love so much about it.
I think one of the things that you're saying, Dr. Rao, that you do as well is you facilitate people's growth, because as they feel more confident, they can venture out and do things that they probably didn't think that they had the ability to because of skin. And people seem to think that skin is such a superficial thing. And I happen to disagree. I think skin is very important, because what you present with is so important in terms of feeling good about yourself and then presenting yourself that way. So I think you do a lot of good for patients in terms of facilitating their happiness. Would you agree?
Yeah, I would 100% agree. And then also, we shouldn't forget about symptoms. For example, itch and pain in the skin. Itch is something that we don't think about. But imagine, if you're scratching and you're itching, you can't sleep. And that lack of sleep can lead to irritability and other issues, even internal issues as well. So we deal with all of that as well. So there is medical aspects to it. And also skin, hair, and nails. We don't just deal with skin, but, imagine your hair was falling out. This is in our wheelhouse of specialty. So we can stop that from happening in most cases. Same thing for nail issues. So we deal with all of that too.
Have you found sometimes that when people focus too much on the external, that it could be problematic?
Yeah, we do see quite a bit of that. And you're right. I mean, in a couple of different ways, your internal problems or even supratentorial issues can manifest in the skin. So we see people who have scratched themselves. They are the cause of their skin issues in some cases. Sometimes it's a manifestation of OCD, obsessive compulsive disorder. Sometimes they have delusions. Frankly, they feel that either self-worth is low, or they're focusing on one specific aspect and magnifying that they think is erroneous or not what it should be. And it's a very sad situation, but we can help them with it. And sometimes we have to seek colleagues to assist, for example, psychologists.
Yes. I know that Janice Lau would send me patients with trichotillomania, the hair pulling one, right?
Yeah.
We call it would be OCD, and it's really tough, right? But so I think they come together, the psychological and the physiological. I talk about happiness being the new healthy. And what about your personal insights that you want to share with our group, our listeners, our avid listeners, on your insights on happiness? Because you're quite the pioneer.
Oh, you're so sweet to say that. I don't know. I think some of it is being happy with what you have. And I think, it's not just that you're happy or unhappy. As you know, there's different degrees of it. So we jokingly say, I like to treat people who are already happy and maybe make them a little bit more happy if it's possible. But I think there has to be that baseline happiness. One of the things we do when I see a patient is I'll divide them up into medical versus purely aesthetic. So purely aesthetic means that they've come in and there's absolutely no medical part of it. They just simply want to look better, a particular aspect of their body or skin. And in those cases, then I also assess, one, can I do it? Is it something that's possible? And then two is, will they actually be happy? So this is something that I assess. And I also factor in my happiness too, because, maybe I can make them happy temporarily, but is their personality such that eventually they won't be, and then they'll be complaining about it? Or is it something that, they might be finding fault with themselves after 2 weeks? Right. And then we might have to alter it. For example, you've heard of fillers and Botox, right? That's a classic example where a lot of my colleagues don't like to do it because it's hard to make everyone happy in that regard. It's not a perfect science to begin with. And two is some people who believe that they need maybe a little bit of filling here or there. If you do it, then they might feel that it's overcorrected. There's too much filler. And then you have to put something to dissolve it. And then you've dissolved too much, and then you have to put more in. So by the time you go back and forth like this, you realize maybe they're never going to be happy with that. Maybe this is a manifestation of a deeper issue that they need to address. So we try to address it early as a clinician, and maybe even tell the patients, you know what, maybe this is not the right treatment for you. Let's focus on something else. Or maybe you need to see someone else.
That's brilliant. Years ago, I was on a panel with Jerry Morse. Remember Morse, right?
Yeah.
I was speaking as a psychologist. He was doing plastic surgery, and we were talking about what I call body dysmorphic disorder. And so you would have a woman coming in and she wants a rhinoplasty, or she wants to have a breast augmentation. And what I found in my clinic is, as a result of this, she can't fit into a normal dress because upstairs, she might be size 40 on top, and at the bottom she's a size 4. So it becomes a problem, but not just with fitting. But what I was pointing out, I don't know if you found this too, is once you start picking on one area of your body, you're never content. It's got to be another and another and another. And you're right, because when you do that, you end up in trouble as a clinician, because it's all your fault. It isn't mine. And
you end up in trouble individually with that patient, but also your reputation, because in a way, the patient is a walking billboard for you as well. And we often say, well, who did that to this? So there comes in the certain ethics of when do you stop, and should you even take this patient on?
That's a tough call, though, don't you think? I think the beginning is just to screen them for quote unquote normalcy, to ask yourself if this is an issue or not. I know in my clinic in Edmonton, I had a woman who was furious with her plastic surgeon because he'd done a rhinoplasty 3 times. Because when he did the first time, she didn't like it. He did a second, he did a third time. And now she was seeing me for help because she felt she had no more faith in him. But what I was trying to get her to look at was acceptance of who she is versus what's on the outside.
Absolutely. And, we need good help in that regard in the psychology department. The other thing is in our training programs, we're starting to recognize this whole filtering process earlier now. So when I was training, we never really thought about this. We just thought about the medical aspect and what we can do and the different technologies we have. But now we're saying whether patients are actually good candidates for it or not, So one big thing is I teach my students that we're not here to cure their disease or to cure their look. We're there to make them happy. Really, that is the end result. So even if you had the worst disease imaginable, psoriasis, but it's not bothering you, as long as it's not going to kill you and you've reached a point that it's improved, maybe that's it. That's it. As long as you're happy, we're usually happy. You don't need to actually clear the person. So that's one thing. The other one is what are some of the flags or red flags to determine that maybe you shouldn't treat a person? The big one is doctor shopping. So we have patients who come and they say, I've seen, 10 doctors before. Nobody was able to help me, but we hear you're our savior, and we want you have a good reputation. We want you to do it personally for me. And in those cases, it's a big red flag because you're right now a hero, but you can drop to a zero just like that. So we have to assess these things. And now we're learning how to do that a little bit more. So more from psychologists.
It's a hard one, though. It's a tough call because you want to help everyone, but there is going to be that fallout at some point, and it's hard to know when that's going to happen.
Yeah, especially young people. I mean, the younger people who are graduating, they're new, and usually they're in debt. And, often these things are paid for out of pocket. So it's hard to say no if somebody's willing to pay for it. But it's not worth it. I tell you, at the end of the day, if it's the wrong patient, it ends up costing us a lot more. And really, you're not helping them at the end of the day.
So who was it who said, wasn't it Dalai Lama who said, want what you have, not need what you want?
I believe so. That's right. And, those kind of things should be mandatory teaching. I think you should be teaching our residents. We need to bring you in.
I really appreciate your insights and your candor and what you've shared with us as to dermatology and how it makes us feel good. And at times, I guess it can be a heartbreaker for you as well when you have to deal with someone with the bad news that this is cancer.
Yeah, that can always be difficult. I mean, the great thing is that technology has really improved. So nowadays, it's amazing what we can do. I mean, we always think of technology as being hardware, like iPads and computers and so forth, but it's also medicines. And we have medicines these days that can do remarkable things, not just with internal medicine, but also external. So people who have really bad 90+% coverage of eczema, we can treat them in record time that we never were able to. And the same thing for cancers. When you used to have a melanoma, it was a death sentence. And, we tell people, you better go ahead and plan your affairs. Now, it's not necessarily true. We have very targeted treatments that can stop the cancers from spreading. So to the point that people don't die usually from those cancers anymore. So it's a little bit easier in that regard. But you're right. I mean, nobody likes to hear that word. It's a loaded word with a lot of bad history. And so there is a gentle, delicate way. Some people are better at doing it, delivering the bad news compared to others. And we try to teach that earlier in our training programs as well.
That's great. Are there any other words of wisdom you want to share with our listeners, Dr. Rao?
I think, I'm very blessed to be in this profession where we can connote improvement. But I think that all clinicians should be very aware of people's psychology, and some have a better bedside manners than others. The ones that are successful in dealing more with, I guess, emotions, as in dermatology, might be a little bit better suited to it. But I think all physicians need a little course in bedside manners. And I do believe that the newer generation is better at doing that than the traditional approach, which was very paternalistic and not very collaborative with the patient. But things are changing. And I actually feel very positive about the medical community at large.
Yes, Bayers actually had a book out, Talk Like a Doc, and in it was teaching interns how to communicate with their patients, forgetting the top-down mentality, let's go into compliance to get them to comply with you. And that was good. But I want listeners did you notice what Dr. Rao did just now, everyone? I was very impressed. He was practicing gratitude. And that's something that is so important. If you want to get on the highway to happiness, you need to be grateful. Another thing he's taught us today is humility. And I appreciate you sharing those things with us
Well, you're so
unintentionally.
sweet, Joan. No, absolutely. The other thing is when we see this in medicine where a patient isn't happy with one doctor and they'll disparage that physician to another physician, and so they'll come with multiple opinions and I say, well, why are you here? Oh, I wasn't happy with this person, or that he did this and that. It was totally wrong or inappropriate. And that I think it's our role to we have a community of healthcare workers. And I usually tell patients, I'm sorry to hear that, so I acknowledge them. But I wasn't there, but I do know the person that you're talking to. I find it very surprising that they would do that or did this, and I can't speak for them, but I can tell you that they're an amazing physician. I've interacted with them on many cases, and my experience has always been very positive. If I would urge you to maybe talk to them a little bit more about it. But one big tenet is try not to disparage our colleagues. I think we have to consider ourselves as a community and help. And unless, of course, it's a very blatant violation of something, then that's different. But overall, I think we need to stick together as healthcare providers.
I think that ripples into the global community as well, that we need to look at not just ourselves, but we need to go beyond the ego and think of us collaboratively moving as a group, right? In whatever field, but moving
Very
together.
much so.
Especially in the face of the fact that I'm saying that we're facing 6 pandemics right now. But the pandemic of the ego is the worst one of the lot, in which you just focus on yourself versus thinking of other people and how it might affect other people. So polarization comes into effect as a result of this.
Yeah, I think that's very wise, and I think the pandemic has also changed my field in many ways. I'll give you one scientific biological thing is that we are seeing more inflammatory conditions over the last 2 years that we never saw before as much. For example, eczemas are rampant, psoriasis, these type of conditions that involve the immune system, where the immune system has been heightened because of global immunity. So people who had rashes before are now having worse rashes. People who never had rashes are now developing very sensitivities to a number of different things. People's self-esteem is increased because now from being in hiding, they are now outwardly showing themselves without masks. So our business is booming in some ways, but we have to be very cautious to think of their people's psychologies too.
That's true, because what we've found is stats in the United States, and I assume for Canada too, is there's a 30% increase in anxiety and depression right now. And the quality of life has not increased.
I didn't know it was so high, but that makes sense.
Yeah, but whatever you had, in my field at least, Dr. Rao, whatever you had pre-morbidly, if you were depressed or anxious pre-morbidly, it was exacerbated by the pandemic. So now people are experiencing the cave syndrome, in which they are reluctant to engage in pre-pandemic behaviors, such as giving a person a hug, going to a fitness center, because you might infect me. I don't want that. So there's that, and then there's also my germaphobe patients are very happy with all of this, by the way, because they're telling me, you see, I told you all along, Neehall, they should have washed their hands. I was right. And the ones who are agoraphobic are equally thrilled with the pandemic. They're, yeah, we should all stay inside. That's the way it should be. But leaving those small groups aside, looking at the big picture, we are looking at the phenomenon called languishing following the pandemic. I don't know if you've seen it in your field as well, but I certainly, with my patients, what's happening is it's a wanting to engage and disengage at the same time, wanting to come close and go away. So it presents itself very much like depression, but it isn't. It's just exhaustion.
Very, very interesting. And the other thing we're noticing, at least I see it in dermatology, pandemic is one. The second trend is the social media rise, and so people want to look good for the social media they want to look good in front of a screen or behind the screen, but they also are not engaging as much, especially young people, with each other, and so they've let a lot of other conditions slide. So face up, they're no problem. That is of course an issue for them. They want to look great on camera, but they're ignoring the rest of themselves. So I've noticed that too, and hopefully with a little bit of education that will change.
But have you noticed that the young people, and I'm talking about 20-year-olds, are experiencing loneliness now in a way that they never did before?
Very sad, right?
Yeah. Well, the pandemic did cause that, but in addition to that, they're looking at our world. Our Generation Z and our millennials are saying, why bother to bring a child into this world? It's terrible. And so they've got that piece going for them. When I was going to school, no one told me things like, watch out for the environment, be careful. Nowadays, that's what our kids are being taught. They're taught
Right.
about the environment and think about the impact on them.
That's right. Oh, I feel for young people these days, there's a lot of pressures on them, and a lot of them manifested through their skin. There's a lot of more cutting.
Yes.
There's a lot more manipulation, scratching, and irritation of things. There's a condition called prurigo nodularis. If you saw these people, they would have welts and excoriations on their body caused by themselves, not caused by a disease process. It's all secondary to them scratching and manipulating their skin, and in some ways punishing themselves for various internal reasons. And in those cases, it's quite challenging. We can definitely help to improve the scarring and their skin, but we can't do too much about the attitude. That's where we need more time, and we need assistance of good people like yourself.
Well, I think, Dr. Rao, I want to thank you on behalf of all of our listeners and also on behalf of myself. I've learned new things today. Thank you for giving us of your valuable time.
You're so sweet, Joan. Thank you so much. And I'm happy to come back anytime.
Oh, don't say that, because we will bring you back.
What a delightful conversation. Thank you so much.
Thank you. In regards to your wife. Bye-bye now.
Thank you kindly. You too.
Bye.
Thank you for joining this discussion on happiness. We hope this helps to inspire you to lead a more joyful life. To dive deeper into the subject of happiness, be sure to check out Dr. Neehall's book, Happy is the New Healthy, available as an ebook or hardcover. For additional resources, visit our website at drneehall.com. Until next time, stay happy.